Hi, this is Dr. GPV Subbaya, spine surgeon, Care Hospitals, Hyderabad. If you look at the trending news today, the famous film actress Samantha was diagnosed with a disease called autoimmune myositis. And she also posted quite a few photographs on Instagram, and she tweeted on Twitter also. Quite a few of my patients called me, and even quite a few of my friends called me and was inquiring about what is myositis, what are the problems with this condition myositis, and how people recover from this problem. So then I thought, I should do a video for the sake of the viewers. So that is the reason I am doing this video. So if you look at what is myositis, so myositis is nothing but an inflammation in the muscles. So there will be involvement of the muscles. Commonly in our clinical practice, we see quite a few patients with myositis. So for example, if you contract common cold, a common viral infection, you get muscle aches and muscle pains. This is all because of myositis. So what happens once you are cured of the common cold, the body pain subsides. That means the myositis also gets cured. But this autoimmune myositis, autoimmune means, what exactly do you mean by autoimmune? Autoimmune means our immune system detects any offending agent, say for example a virus, a bacteria, a parasite or a fungus, and attacks it and kills it. But in autoimmune diseases, what happens is our immune system cannot differentiate between a foreign offending agent, say for example foreign virus or something, and our own system. So as a result, what happens, our immune system generates antibodies against our own bodies. So in autoimmune myositis, the antibodies are produced against the muscles. So there are quite a few diseases under autoimmune myositis. One is polymyositis, second one is dermatomyositis, third one is inclusion body myositis. So usually inclusion body myositis is not included with polymyositis and dermatomyositis. These two diseases are usually discussed together. So that is the reason we are going to discuss about polymyositis and dermatomyositis. So what will happen in polymyositis? The muscles, especially the proximal muscles. Proximal muscles means the muscles close to our trunk. The muscles around the shoulder blade, muscles around the pelvic girdle are affected. As a result, what happens, these muscles become weak, and the patients, they have some amount of difficulty. They might feel they might experience some pain around the pelvic girdle. They might experience some pain around the shoulder girdle. And some might have a difficulty, let's say for example, after walking for some time or after standing for some time, they might feel tiredness or weakness in the hips and buttocks. And if the shoulder girdle muscles are affected, they might have difficulty in doing overhead movements, like for example combing the hair. These things might happen. So that is because of weakness of the muscles. And in dermatomyositis, what will happen, apart from the weakness of the muscles, they can have some rashes over the skin. And these rashes are pinkish in color, and they are typically seen over the face, the neck, front part of the neck, back part of the neck, front of the chest and back of the chest, and even on the shoulders. So the muscle weakness along with the skin rash we call dermatomyositis. Sometimes in severe cases, there can be involvement of the internal organs. There can be involvement of the joints that can result in arthritis. There can be involvement of the heart muscle, cardiac tissue, and there can be involvement of the lungs. There can be involvement of the intestines, and sometimes there can be even involvement of the kidneys. So based on the involvement, patients might experience different symptoms. Say for example, if there is involvement of the lungs, they might experience cough, chest pain, difficulty in breathing, all those things. And if they have kidney issues, they might have tired feeling, they might have reduced urinary output, all these things. So these are the complaints that the patients might have. So then how do you make a diagnosis of polymyositis, dermatomyositis? So based on the history, there is a classical bilaterally symmetrical involvement of the muscles. What do you mean by bilaterally symmetrical? So the muscle weakness is equal in both the legs, it's equal in both the hands. It's not the weakness is more severe in one leg and less severe is in the other leg. So it is equal in both the legs. So this is what we call bilaterally symmetrical weakness in the legs and in the shoulders. That is based on the history. Then there are some blood tests wherein they see elevated muscle enzymes. The common muscle enzymes we test for are CPK, creatine phosphokinase, that is elevated, and there is another enzyme called LDH, lactate dehydrogenase, that's also elevated. So we look for elevation of these muscle enzymes. And the third test we do is what is known as the MRI scan, wherein you can see inflammatory infiltrates into the affected muscles. And the other investigation we do is EMG. EMG is called electromyography. So all of you must be aware of ECG, electrocardiography, wherein you get to know the function of the heart. So likewise, if you do electromyography, EMG, you get to understand the function of the muscles. So there is a typical what we call myopathic pattern on EMG. And finally, we make a diagnosis, confirmation of the diagnosis on muscle biopsy. Muscle biopsy is nothing but, we take a piece of the muscle tissue and examine that muscle tissue under the microscope and then finally make a diagnosis of the myositis. So once we make a diagnosis of myositis, then how do you treat it? So usually we treat them with corticosteroids, and most of the people respond really well to corticosteroids. And sometimes we use immunosuppressants like azathioprine, cyclosporine, cyclophosphamide, sometimes even monoclonal antibodies like rituximab. So with these things, most of the people get better with, they get improvement of the muscle function. And the second part of the treatment is to do exercises, physiotherapy, to improve the strength of the muscles. And the other aspect of treatment would be based on the involvement of the internal organs. Say for example, if there is involvement of the heart, what part of the heart is affected? Is it the myocardium? What kind of disease the patient has? So based on the involvement of the internal organs, the treatment varies. So if you look at the prognosis, what will happen to these patients? So most of the patients recover really well with the medical treatment and they get back to the usual life. So in case of our film actress Samantha, I hope with proper medical treatment she'll become normal and we get to see her again on the silver screen.